Lower body lift. We just spoke about in a previous video how lower body lift is one of the surgeries that we do for our patients after massive weight loss. The weight loss can be because of exercise dieting, it can be because of medicines such as Mounjaro or Ozempic, or it can be because of bariatric surgery. Anyhow, you lose a lot of weight, you may probably be a candidate who needs this surgery. Come, let us have a look. Hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon, director of plastic surgery at Skin Zone Aesthetics in Borivali, West Mumbai. A lower body lift is a surgical procedure where we circumferentially remove the hanging skin and, as it says, lift your body. So, what we do in the front and what happens in the front is slightly different from what happens in the back. So in the front, when you lose weight especially, you will have a lot of hanging skin, basically hanging like an apron. It will also be hanging in the flanks, and you will see the lower part of your thighs and your buttocks sort of just sag and become flatter. It loses its shape and you lose your overall shape. You feel like you are much thinner than what you look. Your weight also tells you the same thing. You're not as big as much as your body says or your inches says, but you sort of have a body inside another body. So you have this hanging skin with very little fat underneath, and this is what we remove in a lower body lift. We sort of remove this lower hanging skin over there. We go to the flanks, we remove that skin, and then we go to the back, right up to the back, and we remove this skin. What this does is we'll go site-wise as to how it changes your body. In the front of your abdomen, it basically does the work what a tummy tuck does. So we can remove this entire panels, pull the skin down, and it makes the front of your abdomen feel tighter and more in shape. When we go to the sides, it will do two things. One, it sort of brings this down, gives better shape to your flanks, removes your hanging love handles. Also, it will lift up your thighs and give a better shape to the outside of your thighs. When it goes to the back, what it does is basically it lifts up your buttocks and your upper thighs and gives better shape to those areas, as well as correcting the lower back area. It does not correct the mid back or the upper back area or the bra rolls. For that, you would require a upper body lift. So this is what a lower body lift is. You had a lower body lift. The recovery is where you would require anywhere between sort of 2 to 4 weeks to completely recover. This is a surgery that is done under general anesthesia with you both lying on your belly and on your back. So it needs to be done in a good setup. You'll probably need to be hospitalized for a day or two, depending on how your surgeon views the surgery and how it's done. During the recovery period, you will need to wear pressure garments. You will need to do massaging, as your surgeon will tell you. The dressing, you'll need to ensure that it does not get wet. If it does, you'll need to get it changed. You may have waterproof dressing, and still you have to be careful. There are a few other things which are very similar to what other body contouring sort of recovery is like, but it's something that our patients love. You're going to see about 60% of the recovery happening in a month's time, about 90% happening, 90 to 95% happening in 3 months. The final results, I would say, would be at 6 months. We do these surgeries in patients who are in stable weight. We don't want you still losing weight. We don't want you gaining weight. These are surgeries where we want to do these for patients who are at stable weight, having good nutrition, eating well, and sort of taking care of themselves. So that is how the post-op recovery will go as well. So that's about the lower body lift. In the future episodes on this series of massive weight loss surgeries, we'll be talking about upper body lifts, arm lifts, and thigh lifts. So stay tuned. If you have any other questions, put it in the comments below or set up a consultation with us.